Hello everyone, I'm Byung-Moon Lim, Professor of School of Korean Medicine, Busan National University, South Korea. This time, I would like to introduce Korean medicine in the National Health Insurance System of Korea. Let me start the lecture with brief overview of healthcare system of South Korea. This figure depicts the resource flows among government, consumers, corporations, and service providers covered by national health insurance, private health insurance, and public health program operated in the public health centers. A conspicuous feature of South Korean healthcare delivery is that patients are given a choice of providers, including hospitals, clinics, dental care, traditional medicine, pharmacy, and public health center, and even emergency wards. National health insurance mostly finances the South Korea's health system. The national health insurance covers about 97% of the population, and the remaining 3% is covered by the medical aid program, which is a tax-funded program for low-income citizens. In contrast to the public sector dominant financing, healthcare delivery relies heavily on the private sector. As of 2018, almost all clinics and about 94% of hospitals were privately owned. Providers are paid by the fee-for-service in return for providing services that are covered by insurance. For 7 inpatient services such as normal delivery and appendectomy, hospitals are paid by Korean DRG. DRG means diagnosis-related groups, and this is a patient classification system for reimbursement of medical services. Total expense is reimbursed in part by National Health Insurance Service for insurance-covered services, and the rest is paid by patient out-of-pocket money for co-payment and non-insured services. Let's go into main contents of this lecture, Korean medicine in the National Health Insurance. Benefit package of Korean medicine health insurance includes these items. Fee for outpatient care is reimbursed when the doctor asks and listens from patient for their basic symptoms. Fee for inpatient care is a fee for stay in the hospital per day. Herbal preparation is manufactured herbal medicine products such as granule, powder, ointment, syrup, etc. Insurance coverage for herbal preparation is somewhat complicated, so I will explain this in the next slide. Acupuncture is a kind of needling technique that stimulates acupuncture points on the human skin. Moxibustion is another method that stimulates acupuncture points by burning of moxa corn. Cupping is a technique to make negative pressure on the skin by vacuumize the cup to remove stagnated bodily waste on the skin. Some diagnostic tests are reimbursed. Pulse detection test using pulse detection device and pattern identification is to diagnose human condition based on traditional diagnostic theory, and to find out which organ's function is weak or overloaded. Meridian function test is also to know the function of meridian using an EAV device. EAV means electroacupuncture by 4, and this is invented in Europe. And some physical therapies are covered by health insurance. National health insurance covers herbal preparations for two types. One is a single herb extract, and the other is mixed herbal preparations. Initial stage of Korean medicine coverage, only 68 single herb extracts were covered, and 24 herbal formulae that can be made within 68 single herb extracts were covered. Later on, the number of notified formulas increased to 56, but the number of single herb extracts is still 68 so far. For your understanding of herbal medication, I show you some pictures. This is a licorice, and this is ginseng. These are raw herbal medicines with minimum processing, such as washing, drying, and cutting. Traditionally, Korean medicine doctors both prescribe and dispense herbal medicines. They packed herbal medicines using papers and gave it to patients. Then patient uh, put one pack of herbal medicines into traditional pot and boiled it with water to extract effective components. After 1 or 2 hours boiling, herbal medicine decoctions was made. This is herbal medicine decoction. Usually, 2 paper packs of herbal medicines were taken for 1-day dose. Depends on the patient's disease and conditions, the number of paper packs varied. But Korean medicine doctors used to provide 20 packs per visit. As you can guess, making herbal decoction was not an easy work for patients. In 1970s, electric pot was developed, and it helped patients make herbal decoctions at home. In 1980s, herbal medicine extracting device was developed. The development of this extracting device enormously expanded herbal medicine use by enhancing convenience of herbal medication. Using this device, every Korean medicine clinic and hospital began to provide herbal decoction packs to patients. Patients do not need to boil herbs by themselves anymore. These are all herbal preparations that are made at pharmaceutical companies. Among them, upper ones are single herb extracts, and bottom ones are mixed herbal preparations. I show you an example of 4-gentleman decoction to help clear understanding of single herb extract and mixed herbal preparation. 4-gentleman decoction is famous herbal medicine formula that has been used for digestive disorders for more than 1,000 years. Single herb extract is made by boiling just one herbal medicine and adding the excipient such as starch or corn powder. These powders are ginseng extract, white atractylis extract, Poryacoccus extract, and licorice extract. When we gather these extracts and mix, it is a mixed herbal preparation. And this is type of herbal preparation that National Health Insurance of Korea reimburses at this time. The reason why I explained this too long is this coverage type is related with the failure of herbal medicine coverage in National Health Insurance. As you see, each single herb extract contains excipient. So, when we mix some single extracts, the final mixture contains considerable amount of starch or corn powder. This causes indigestion or reducing efficacy of herbal treatment. That's why Korean medicine doctors hesitated to use mixed herbal preparation from the initial stage of Korean medicine insurance coverage. Korean medicine doctors continuously have demanded to expand herbal medicine coverage type, including compounded herbal preparations. Compounded herbal preparation is made by boiling herbs all together and put excipient just once or not. It is no doubt that compounded herbal preparation need to be reimbursed in the National Health Insurance. Japan and Taiwan reimburses the cost of compounded herbal preparations in their National Health Insurance. However, in Korea, compounded herbal preparations are not covered due to somewhat political reason between Korean medicine doctors and Western pharmacists. Western pharmacists demand separation of prescribing and dispensing herbal medicines as a precedence of coverage of compounded herbal preparations. However, Korean medicine doctors strongly oppose the separation of prescribing and dispensing of herbal medicines. Customarily, Korean medicine doctors perceive herbal medicine dispensing as their own job. So Ministry of Health and Welfare could not decide the herbal medicine coverage expansion. This is another long story. To prevent patients from experiencing a moral hazard, the Korean National Health Insurance applies both co-payment and co-insurance. The guardians of patients under the age of 7 years have to pay 20% of the total treatment amount themselves, while for patients aged 7 to 64 years, the charge is 30% of the treatment. The fee structure is more complicated for patients aged 65 years and older. Patients pay $1.5 US up to a total treatment amount of $15 US. Korean medicine outpatient and inpatient care are reimbursed using the fee-for-service system based on the resource-based relative value scale. We call it RVRVS. RVRVS was originally developed by Professor Shao at Harvard University in the 1980s. The RVRVS system was implemented for Western medicine and dental procedures in 2000 and for Korean medicine in 2002. In the RVRVS system, the fee for each procedure is calculated by multiplying the relative value, RV, of each procedure or service by a conversion factor, CF, that corresponds to a monetary amount per RV score. Relative value consisted of physician's work practice expense, and malpractice value. The RV scores are adjusted every 5 years based on the research data, and the CF conversion factor is determined at the end of each year based on a negotiation and contract. In principle, between the National Health Insurance Service and the Association of Korean Medicine. This is the fee schedule for Korean medicine procedures. Of these items, the most frequently utilized treatment apparatus are acupuncture, maxibustion, and cupping. Acupuncture treatment may be provided alone, but it is more accompanied by cupping or maxibustion treatment in Korea. Since the reimbursement for outpatient care of national health insurance follows the fee-for-service way, Korean medicine doctors tend to provide as many treatment apparatus within the standard. Tuna manual therapy began to be covered since 2019 after a 2-year pilot coverage project examining its clinical effectiveness and financial effect. The expenditure of national health insurance is rapidly growing. Total expense was $71.8 billion in 2019. During the last decade, total expense increased over 120%. And this increase is primarily driven by the expense increase in tertiary hospital. It is a large-scale hospital and long-term care hospital. The proportion of expense increased from 15.9% to 17.5% in tertiary hospitals, and 3.4% to 6.9% in long-term care hospitals. The orange colored bar represent Korean medicine expenses. With respect to the number of claims, in 1990, the early stage of Korean medicine health insurance, Korean medicine represents only 1.1% of the total national health insurance claims. But this percentage increased to 7.1% by 2019. The total expense attributed to Korean medicine was only $7 million in 1988, but had increased to $3 billion in 2019, representing 3.5% of total expenditure of national health insurance. If the pharmacy portion was excluded, the total expense of Korean medicine represented 4.4% of the total expense resulting from all medical institutions in 2019. Although the annual treatment amount has steadily grown, the proportion of the total expense has decreased since 2000 because of the rapid growth of tertiary hospitals and increase in number of long-term care hospitals, as you saw earlier. The roles of hospitals and clinics have not yet been adequately divided in South Korea, and therefore, the growth of the hospital visits causes the decrease in the clinical visits. Most institutions of Korean medicine are clinics. The biggest part of Korean medicine expense is cost of acupuncture, maximization, and cupping, and followed by consultation fee and inpatient care and herbal medicine. Herbal medicine is also frequently used strategy along with acupuncture. However, it only accounts for 2.1% of total expenditure of Korean medicine health insurance as of 2019. As I already told, these results come from the fact that raw herbal decoctions are not covered by the National Health Insurance and only mixed herbal preparations are covered. Recently, in 2020, Ministry of Health and Welfare decided to implement 3-year pilot coverage project for herbal decoctions for the treatment of Bell's palsy, stroke after effects, and menstrual pain with the annual budget of 42 million US dollar. Although the use of Korean medicine is increasing, diseases treated by Korean medicine have been concentrated in musculoskeletal diseases. This table shows the 10 most common diseases for outpatient reported in the health insurance claims from Korean medicine hospitals and clinics. With the exception of indigestion, most are musculoskeletal disorders such as sprain and tension in the joint. This is because the Korean medicine coverage was designed mainly for acupuncture and maximization, which have strength in musculoskeletal diseases. Also for inpatients, musculoskeletal disorders and neurological diseases were most frequent diseases in Korean medicine hospitals and clinics. Back pain shows highest frequency, followed by lumbar spine and pelvis problem, intervertebral disc disorder, and knee arthritis. Now, I'll talk about Korean medicine and other health insurance. Industrial accident compensation insurance in South Korea has reimbursed the Korean medicine service for industrial accident patients since 1997. In the late 1980s, some coal mine workers suffered from pneumoconiosis, and they demanded the government to cover Korean medicine treatment in the industrial accident compensation insurance. Since then, the social awareness of the usefulness of Korean medicine for the treatment and rehabilitation of industrial accident patients has increased. Korean medicine services are reimbursed in cases of patients with an injury who require Korean medicine care after surgical treatment, and musculoskeletal diseases such as lumbago and sprain, and other occupational diseases. In industrial accident insurance, the cost of acupuncture, maximization, cupping, physical therapy, Korean medicine diagnostic tests are reimbursed. In addition to National Health Insurance covered benefits, payment for herbal decoctions and decocting fees has been covered from 2009. Number of claims of Korean medicine services was about 10,000 and total expenditure was $7 million in 2019. It accounted for 1.1% of total number of claims and 0.7% of total expenses of healthcare reimbursement for industrial accidents. Medical expense occurring from the car accidents are reimbursed by motor insurance, and the reimbursement for Korean medicine care began in 1999. In addition to services that are paid by national health insurance, herbal decocting fees, tuna manual therapy, pharmacopuncture, or herbal acupuncture, digital infrared thermal imaging, and physiotherapy such as hot pack, cold pack, infrared, transcutaneous electrical nerve stimulation, and interference current therapy. These are currently reimbursed by motor insurance. In the past 5 years, Korean medicine expenses for car insurance have increased rapidly. Korean medicine expenses for car insurance represented 48% of total expenses in 2019, while Korean medicine shares only 4.4% of total national health insurance expenses. The reasons why Korean medicine portion in the car insurance is growing so rapidly are, firstly, Korean medicine has some merit to treat diseases from car accidents using herbal medicines and acupuncture, and Korean medicine doctors actively promoted it. Secondly, the cost of herbal decoctions that are not covered in the national health insurance are reimbursed in the motor insurance. Lastly, Western hospitals do not want their patients to stay long because the profits of hospitals come from mainly medical tests and surgical operations. But Korean medicine hospitals and clinics provide sufficient stay because everyday herbal medication is main source of income. These are the future tasks. Firstly, scientific evidences of Korean medicine procedures, its effectiveness and safety and cost effectiveness data need to be accumulated. Secondly, Korean medicine benefit package need to be expanded, including compounded herbal preparations, raw herbal drugs, physical therapies, etc. Lastly, the more efforts are needed to develop new technologies and procedures based on Korean medicine theory. These are references. This is the end of my lecture. Thank you for watching it. And if you have any questions or comments, please contact me. Thank you. Bye.